I'm Edie Lush, and I'm inside the Hub Culture studio. It's Davos 2019. Very pleased to be talking now about healthcare. Bob Garrett, he's the CEO of Hackensack Meridian Health, has stopped by. Tell me what your experience of Davos is this year and how much focus on health there's been.
Thank you for having me, Edie. I've been now at Davos 3 years at the World Economic Forum, and I would say this has been the best year yet. There's been a lot on healthcare. The healthcare community that we have here at Davos has grown in those 3 years that I've been attending. There's probably about 60 or 70 companies now that are represented, and there's been just a lot of great meetings, a lot of great interaction, bilateral meetings as well, new partnerships being formed. It's just been a really great process and very, very interactive.
So tell me about some of the changes that you see happening in health and how those discussions have been shaped here in Davos. There's a lot about telemedicine. There's a lot about reskilling nurses, doctors, people who work in the healthcare industry. What have you encountered that's really inspired or surprised you?
Well, you know, we've been talking a lot about the aging of the population globally and what we need to do to address that. And with aging comes a lot of people with chronic illnesses, chronic diseases, non-communicable diseases. So what we need to do really is to deploy a lot of prevention. So more and more care is actually being rendered outside the four walls of the hospital. We need to get into communities. We need to really focus on nutrition, on exercise, on keeping people well so that we can either prevent those diseases or we can at least delay the onset of them. So that's one thing that we've been talking about here at Davos. Another thing, as you just alluded to, are the emerging technologies in healthcare. So, you know, one is telehealth and telemedicine, and that's really providing incredible amount of access to healthcare that people didn't have before. You know, they said the center of the healthcare universe used to be the hospital. The future center of the healthcare universe is going to be our smartphone because so many people are going to be receiving health and health information as well as healthcare through the smartphone. And a good example that I used this week was in China. There's an app that is very popular, healthcare app online. And I think almost 230 million Chinese citizens are now using it to receive their health care. So that's really the future of healthcare. The other area is artificial intelligence. That new technology is really literally saving lives around the globe.
Well, I know that I've heard of lives being saved by the smartwatch telling you your heart rate's not regular. Go see a doctor now. What else?
So artificial intelligence through predictive analysis can really predict when a heart attack is coming, when a stroke is coming, when you're about to have an acute episode of congestive heart failure, or it could even detect cancers like breast cancer. So it's really literally saving lives. And I see that proliferation of new technology really transforming healthcare as we know it.
I want to talk to you as well about education because I know that medical schools are part of your portfolio. There's been so much on the need for lifelong learning. How do you bring that into a medical school, which is so intense and so it's so necessary to have so much information before you even get started in the first place?
Right. So at Hackensack Meridian, we're fortunate. We started a new school of medicine this past year, and it's that's not an everyday occurrence that a new school of medicine opens up. But with a new school, I think comes a responsibility to be innovative, to be forward thinking and forward looking. So what we're doing to train the new generation of doctors is really focusing in on population health for one. So we actually have what we call a community immersion program where medical students adopt two families during their medical education, and they spend a lot of time with these families, many times in underserved communities. They get a chance firsthand to see some of the obstacles that they go through, whether it's adhering to their medication regimen, their diet, their exercise. I think that's really going to make a very outstanding physician in the future.
Really empathetic and
very empathetic and understanding, some of the challenges that communities and families are facing firsthand. The other piece is, which I think is going to be really important, is we're doing interprofessional academics. So our medical students are actually in the same classroom with nursing students and allied health students. The data shows that when we can break down the barriers and those disciplines work as a team, that better healthcare outcomes result. So we're really excited about that piece. Then the third piece is really exposing them to these new technologies, telehealth, telemedicine, artificial intelligence, precision medicine. So that's part of the curriculum as well. But in addition to doctors, we really need to retrain our entire workforce to really meet the needs of the healthcare community in the future. So that's an ongoing process. You know, continuing education is a big part of what we do at Hackensack Meridian.
Bob, I really thank you for coming by the Hub Culture studio here in Davos to speak about healthcare and the future of healthcare. And I'm Edie Lush.